Being a patient is very different than being a doctor. You have a lot more sympathy and empathy for the patients because now you're on the other side. I've learned it's not so easy to be a patient.
Well, tonight, the amazing recovery of a dentist from Long Island who was paralyzed after he was hit by a wave while on vacation.
Every year, a group of my friends go on what's called a mancation. This was our 13th, and we headed towards the Dominican Republic. Standing in 3 feet of water, I was hit by a wave, knocked down, my head hit the ground, my spinal cord was injured. I didn't know how badly at the time, and I was paralyzed. Laying in 3 or 4 feet of water face down, not being able to move your legs and arms is a pretty scary place to be. That's when I started to negotiate with God. Please don't take me. I have a baby coming. My grandson would be born 2 months later. But at that time, all I wanted to do was see him. And luckily, about 30 or 40 seconds of floating, one of my buddies who was out in deep water saw me and realized I was in trouble and pulled me out of the water. I couldn't move my arms and legs. My face was bleeding. But looking at his face, I realized something bad had happened. When I arrived at Glen Cove Hospital, the first or second day, I met Elizabeth, my physical therapist.
I knew with his condition, central cord syndrome, that the arms are more greatly affected than the legs, so I had a great deal of hope that he would be walking. What we were unsure of was how much function he would gain back in his arms and his hands, so we really had to take everything one day at a time.
Within a couple of days, with all these amazing apparatus that she invented, put together specifically for my needs, I was up with 3 people around me, learning how to walk again. Within a week or two, I was doing more and more steps, and eventually walking with a walker, and eventually walking without a walker. And pretty amazing to me.
So much of my role as a physical therapist is just encouraging patients day in and day out to show up for themselves and to stay motivated. For Dr. Brofsky, it was really the ability to meet his grandson and be with his family and get back to work.
Knowing that I had to get in shape so that when he was born, I'd have to fly to Kansas, I really worked extra hard. When we flew there and my daughter handed me the baby, there is no amount of emotion that can explain that feeling. Just being a grandparent was great, but knowing that I almost didn't see him was an amazing, amazing feeling, which will never be forgotten. Elizabeth always cared about me as a person. She made sure when I really didn't want to do work, she pushed me. And when she thought I did enough work, she told me, it's enough.
Hearing all the kind words Dr. Brofsky has said about me really makes me feel humble and grateful to do what I'm doing. You know, it's easy to get caught up in the day-to-day hassles and struggles, but at the end of the day, patients and individuals like Dr. Brofsky are why I chose to become a physical therapist. So I'm really honored to have worked with him.
I've always looked at the patient a certain way, but now I even look at them a little differently because I was a patient. I've seen some amazing doctors, nurses, therapists that will have helped me, and I'll be happy to give it back now.